Can I have laser treatment for wrinkles but without the downtime?
Since the mid-1990s, laser treatment has become well established as one of the most effective ways to treat wrinkles. Of course, the term laser evokes science fiction imagery, which implies immediate results with no downtime. In reality, there are different ways that lasers can be used to help improve the appearance of wrinkles based on principles which determine how the skin heals after light energy is absorbed by different parts of the skin and how different forms of energy interact with these parts of the skin. One approach, for example, is using a laser like the CO2 laser, which is absorbed by water to remove the top layer of skin, so afterwards a new, smoother, and more youthful layer of skin can come in. This is known as ablation. In addition to removing wrinkled and discolored skin, the heat generated by the CO2 laser can cause the skin to contract and stimulate cells called fibroblasts to produce collagen. Another laser technology which can improve the appearance of wrinkles without any downtime is a non-ablative laser. When you learn about the existence of these two very different options, how do you decide what to do? At a time when a lot of lasers are aggressively marketed to be the best laser for wrinkles every other day, it's helpful to understand some principles of laser treatment so you can see past the noise and the hype. If your goal is to improve the appearance of wrinkles, I'll discuss how I apply customized strategies which include lasers to help my patients improve their wrinkles without downtime every day in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been performing laser treatment since the mid-1990s with the first fully ablative CO2 lasers. As technologies changed, I continued to integrate newer technologies such as fractional CO2 and erbium laser, as well as more recent technological advances such as long-pulse erbium and ND-YAG laser, in addition to non-ablative technology such as Q-switch laser. I also perform radiofrequency treatments like Pelivate, particularly for darker skin types who are not laser candidates. I was also among the first proponents of using platelet-rich plasma, or PRP, for improving skin quality. When the first fully ablative CO2 lasers were used in the 1990s, the outer layer of facial skin would be removed, leaving the skin raw. The aftercare was essentially burn management. Downtime was for several weeks, with intense redness lasting for months. Once the new layers of skin came in and the wrinkles improved, the patients were mostly happy with their results. This prolonged downtime, as well as conspicuous appearance in the first week to 2 weeks, kept a lot of potential patients away from this treatment. Fractional laser technology allowed for shorter healing times for partially ablating the top layer of skin and allow the skin to heal faster. Fractional laser treatments such as CO2 and erbium are very effective in improving skin quality and texture, as well as stimulating collagen, but they still require some downtime, although much less than fully ablative laser treatment. So how can we apply the benefits of laser technology without any downtime? By first understanding the underlying problem in the skin we're trying to address. I look at it this way. The skin, which is about 2 millimeters in thickness, is made up of 2 layers, the dermis and the epidermis. The dermis is the backbone or foundation of the skin. This foundation is supported by cables made of collagen. Aging, health, and environmental factors cause breakdown and loss of collagen. Loss of collagen in the skin has an effect on the skin like the breaks in the foundation of a structure that would be like a building. Lines or wrinkles which are present at rest, referred to as static lines, can be the result of loss of support caused by loss of collagen. A universal goal and the claim of superiority for every new technology is the stimulation of the skin to produce collagen. If you look at the claims made by technologies such as laser, radiofrequency, and microneedling, they all list the stimulation of collagen production as being a significant benefit. Much of this stimulation of collagen is based on the physiologic response of the skin to a medically induced controlled injury. The skin recovers from injury by producing collagen. There is, however, a limit on how much collagen can be generated by your skin, regardless of the technology. This concept is something that I have observed as being generally ignored by practitioners. It is common in our practice to see a patient after they had several different laser treatments by several different practitioners over the course of a few years. I often find the skin to be scarred or thinner than I would expect. This is the result of overtreating. I compare this injury to the skin to be comparable to the type of injury which occurs if you force someone with weak muscles to lift weights that are too heavy. This means that a strategy for wrinkle treatment needs to be well thought out before being implemented. To improve the appearance of wrinkles, laser treatment can be used to stimulate collagen in the dermis to restore support and renew the top layer of skin to restore even texture and color. During my assessment, I look at what my patient wants to improve and determine the level of severity of the fine lines they're interested in treating. I explain to my patients that as a general rule, the deeper the lines, the more aggressive the laser treatment needs to be. Practically speaking, I find that unless I'm doing a surgical procedure such as eyelid surgery or facelift surgery, when people are already taking a week or so off, so they have a period of time they will not be seen, my patients generally prefer to avoid procedures where the skin is ablated and they have to be out of commission, even for a few days. For minimal to moderate depth wrinkles, laser treatment can be performed without ablation and without the downtime. One laser I use is a non-ablative 1064 YAG laser. The outer layer of skin is preserved, but the heat of the laser can penetrate into the dermis to induce a collagen response and remodel the skin. Since wrinkles are often associated with sun-induced skin discolorations, I also treat these discolorations, referred to as solar dyschromias and solar lentigos. I use the Q-switch laser to treat pigment at this level without ablation of the top layer of skin. In our office, we use the same Q-switch laser for tattoo removal. I then deliver platelet-rich plasma, or PRP, to induce maximal collagen production within the body without using heat. PRP is a concentration of wound healing and growth factors present in your blood. PRP is prepared by drawing a patient's blood and then spinning the blood in a centrifuge to separate the platelets. The skin can benefit from PRP with collagen stimulation, improvement in blood supply, increase in skin thickness, which ultimately results in a nice glow and luster to the skin, which is fairly unique to PRP. While PRP is often injected into the skin or applied topically after microneedling, I find that a treatment we call skin boosting by using a specially designed device effectively delivers PRP directly into the skin without causing swelling, bleeding, or bruising. PRP can also be mixed with hyaluronic acid to provide a scaffold for the fibroblasts to place collagen more effectively, as well as adding hydration to the dermis. To improve the skin surface, or epidermis, without downtime, we help our patients with a procedure called HydraFacial. HydraFacial uses water for the same effect as microdermabrasion to remove dead skin cells from the outer skin layer, while avoiding irritation often associated with traditional microdermabrasion. Glycolic acid and hyaluronic acid is often used during a HydraFacial session, which provides maximal benefit to the epidermis. HydraFacial also involves no downtime, and the skin can look really good right after the procedure. More aggressive lasers have an important role in wrinkle treatment and skin improvement. Fractional and partially ablative lasers like CO2, erbium, and Nd:YAG are still highly effective for combined treatment or improvement of the dermis and epidermis. Although downtime is required anytime the outer skin layer is partially ablated, it can be for a limited time. In my practice, I strive to help my patients with minimal to moderate wrinkles with combinations of technologies such as non-ablative laser, PRP, and HydraFacial to get maximal results with no downtime. I provide my patients with perspectives and a strategy for maintenance. Consumers are barraged with aggressive messaging from companies who pay celebrities to claim that the secret to their youthful appearance is the technology that the celebrity was paid to endorse. You can potentially avoid getting your skin cooked and damaged by finding an ethical and highly experienced doctor to be with you for the long term so you can achieve your goals and look your best. I hope you found this information helpful. Thank you for your question.